Welcome to another episode of Med Madness, the podcast where we delve deep into medical topics that are crucial for your studies and future practice. Today we are exploring the fascinating and complex world of acute pericarditis. This condition is essential for medical students to understand due to its varied etiologies and presentations, which can significantly impact patient outcomes. In this episode, we will cover what acute pericarditis is, its causes, symptoms, diagnostic methods, treatment options, and we'll also discuss a real-world case study. Let's dive in. Next, let's discuss what acute pericarditis is. Acute pericarditis is an inflammation of the pericardium, the sac-like covering of the heart. This condition can be caused by a variety of factors, including viral infections, autoimmune diseases like systemic lupus erythematosus, uremia from kidney failure, and post-myocardial infarction complications, both early and late, such as peri-infarction, pericarditis, and Dressler syndrome. Understanding these causes and their associated risk factors is crucial in diagnosing and managing this condition effectively. Pathophysiologically, acute pericarditis involves inflammation of the visceral and parietal layers of the pericardium. This can result in pericardial effusion, where fluid accumulates in the pericardial space, potentially leading to complications like cardiac tamponade. Elevated levels of blood urea nitrogen, for example, in uremic pericarditis, can directly cause this inflammation. Next, let's discuss the symptoms and clinical presentation of acute pericarditis. Patients with acute pericarditis typically present with sharp, pleuritic chest pain that often radiates to the back and is relieved by sitting up and leaning forward. Fever may accompany this pain. One hallmark sign is a pericardial friction rub, a high-frequency grating sound best heard along the left sternal border, with the patient leaning forward. Depending on the etiology, symptoms can vary. For instance, in uremic pericarditis, chest pain is worse in the supine position, while in peri-infarction pericarditis, the pain can radiate to the trapezius ridges. Now, let's move on to how acute pericarditis is diagnosed. Diagnosing acute pericarditis involves a combination of clinical evaluation, electrocardiography, and imaging studies. ECG often shows diffuse ST segment elevation and PR segment depression, which are classic findings. Echocardiography is essential to detect pericardial effusion and assess its severity. In specific scenarios like uremic pericarditis, the absence of ECG changes like diffuse ST elevation is noted, which differentiates it from other causes. Additionally, blood tests can reveal markers of inflammation and underlying causes, such as elevated blood urea, nitrogen in uremic pericarditis, or elevated inflammatory markers in autoimmune causes. Let's now discuss the management and treatment of acute pericarditis. Treatment of acute pericarditis depends on the underlying cause. For viral or idiopathic pericarditis, non-steroidal anti-inflammatory drugs and colchicine are the mainstays of therapy. In cases of uremic pericarditis, initiation of dialysis is crucial and often leads to symptom resolution. Management of post-myocardial infarction pericarditis, including peri-infarction and Dressler syndrome, usually involves supportive care, with NSAIDs being used cautiously to avoid impairing myocardial healing. Corticosteroids may be reserved for refractory cases or specific etiologies like autoimmune pericarditis. It is also essential to monitor for complications such as cardiac tamponade, especially in patients with significant pericardial effusion. Lifestyle modifications and preventive measures such as managing underlying autoimmune conditions or kidney disease are important in preventing recurrence. Next, let's consider a case study to illustrate these points. A 45-year-old male with a history of chronic kidney disease presents with sharp chest pain radiating to his back, worse when lying down and improved when sitting up. He has a friction rub on auscultation and his blood urea nitrogen is elevated at 65 mg/dL. ECG does not show diffuse ST elevation. Echocardiography reveals a pericardial effusion. Given the clinical picture, a diagnosis of uremic pericarditis is made. The patient is started on dialysis, leading to a resolution of symptoms. To summarize, acute pericarditis is a multifaceted condition with various etiologies and presentations. Early diagnosis and appropriate management are critical to prevent complications and improve patient outcomes. Understanding the clinical features, diagnostic tools, and treatment options is essential for all medical students and practitioners. Thank you for tuning in to this episode of Med Madness. Remember to engage with our pre- and post-podcast quizzes and use our Anki flashcards for effective study. Stay curious, stay informed, and let's continue to change the medical education system together. Until next time, take care.